Hi, I'm Sasha, and the community I have chosen is Lima, Ohio. I chose Lima because I was born and raised there for about 13 years. Even when I moved, I visited very frequently, and I still have family members living there today. I was just interested in looking more into the community I was once a part of. Lima is in the northwest Ohio along Interstate 75. It's pretty close to Dayton. It's located in Allen County with a population of about 36,000. I wouldn't describe Lima as very diverse. It's about 64% of whites, 25% African American, and 6% of two or more races. The community strengths that I found are the two hospitals in town, which would be St. Rita's and Lima Memorial Hospital. There's also a Mercy Health Rehabilitation and Therapy Center, and then just insurance like Medicaid, Medicare, and WIC is available. And I just thought it was good that residents have access to insurance and food assistance. The biggest risk factors that I found is cancer. Cancer is the number one leading cause of death in Lima. Coming in at a close second as a huge risk factor was heart disease, and diabetes as the third risk factor. The priority issue that I selected was heart disease. In Lima, diabetes and obesity are also common in both risk factors that contribute to heart disease. So I went with heart disease because I felt like it could help combat multiple problems within the community. My ultimate goal is to decrease the risk of cardiovascular disease for residents of Lima, Ohio within 2 years. My objectives were that residents will express increased awareness on the risk factors and lifestyle changes that can be made. My residents will have a greater knowledge and understanding of risk factors for cardiovascular disease, as well as a result of the educational programs, and that the residents will have greater knowledge on heart healthy diets and exercise. My interventions are a health fair with free health screenings that provide healthy food choices as well, and educational brochures, a 5K walk to encourage heart healthy exercise and to educate residents on the importance of 30 minutes of daily walking and other aerobic exercises, and then just incorporating wellness initiatives into events that families are likely to attend. So if there's like some type of fair or uh, like some type of concert or a play or anywhere where a lot of people are congregating, just trying to educate them, set up a table, just educate people wherever we can. The partnerships and resources I found were Heart and Vascular Institute, Lima Memorial Preventative Cardiology and Heart Care, and then Right at Home Heart Disease and Heart Condition. I also added in Allen County Job and Family Services, just for people with any disparities that need help, getting to the doctor and, finding a way to afford the care that they need. I also included the Lima Public Library just for education, books, articles, anything that can be read regarding cardiovascular disease and ways to prevent it or even maintain it if they already have it. Um, my program evaluation will be a pre and post test conducted to assess the community's understanding of risk factors and lifestyle modifications. So maybe just handing out a test before educating them, seeing what they know prior, and then seeing what they know after handing out brochures and talking with them and just educating them. My next one was within 2 years, there'll be testimonies among residents that there has been self-documented weight loss. So just hoping to see weight loss within the community, if they're following a heart-healthy diet, if they're exercising for 30 minutes a day, just seeing an overall decrease in BMIs. And then just conducting community surveys to assess if residents are more confident in their ability to reduce their risk of cardiovascular disease. So just seeing how people are feeling in the community and if they feel any more confident or more competent in their abilities to, reduce their risk of cardiovascular disease and take care of themselves. Um, Overall, it was a really good learning experience for me. I learned about, I did not know that there was all of these serious risk factors within Lima, so it was very interesting and a very insightful experience. I also learned that a community nurse really has a lot on their plate and a lot of things that they have to do, not just for people who are um, underprivileged, but for the community as a whole. And overall, it was a great experience, and I learned a lot.